Aspirin in bodybuilding, the old-school painkiller with surprising effects. Introduction. Before ibuprofen, naproxen, and diclofenac, there was aspirin. For over 100 years, athletes have used this drug, not just for pain, but for its unique blood thinning and recovery effects. In bodybuilding, aspirin has been both praised as a recovery aid and criticized as a silent killer. Let's dive deep into how aspirin really works in the world of strength and aesthetics. How aspirin works. Biochemistry. Aspirin equals acetyl salicylic acid, or ASA. Irreversibly blocks COX-1 and COX-2 enzymes, reducing prostaglandins, inflammation, and pain. Unlike other NSAIDs, it permanently inactivates platelets, leading to a blood-thinning effect that lasts 7 to 10 days. It also influences mitochondria, oxidative stress, and nitric oxide pathways. Why bodybuilders use aspirin? Pain and inflammation relief. Used for sore joints, tendons, and muscle aches. Old-school bodybuilders in the 70s and 80s used aspirin like training vitamins. Blood thinning and pump. Aspirin thins the blood, increases circulation, sometimes enhancing the muscle pump. Reduced clotting risk when running oral steroids that thicken the blood. Recovery booster. Believed to reduce DOMS, or delayed onset muscle soreness after brutal training. Some athletes use it post-workout to manage inflammation. Cutting and fat loss myths. The old ECA stack, or ephedrine, caffeine, and aspirin, was a legendary fat-burning combo in the 90s. Aspirin was thought to prolong the thermogenesis from ephedrine and caffeine. It's still debated today, but the ECA stack was banned in most countries for safety reasons. Heart protection during steroid cycles. Some pros take low-dose aspirin, 75 to 100 milligrams daily, when on anabolic steroids to reduce blood clot risk. Especially common in athletes who run oral steroids like Anadrol, Winstrol, and Dynabol that raise blood pressure and thicken the blood. Benefits in bodybuilding. Cheap and accessible, reduces minor aches and pains, improves circulation, some claim better vascularity on cycle. Low-dose aspirin may lower the risk of heart attack and stroke in steroid users. Topical formulations exist, but less common. Risks and side effects. This is where aspirin gets dangerous. Bleeding risks. Because it thins the blood, it increases risk of nosebleeds, internal bleeding, and stomach bleeding. Risk skyrockets if combined with alcohol, steroids, or other NSAIDs. Stomach and digestive issues. Strong irritant to the stomach lining. Can cause ulcers, gastritis, and GI bleeding. Risk increases massively when combined with anabolic steroids or corticosteroids. Muscle growth interference. Like other NSAIDs, aspirin blocks prostaglandins, which can blunt hypertrophy and recovery if used daily. Occasional use is fine, but chronic use equals reduced muscle gains. Kidney and liver stress. Long-term use can stress kidneys, especially in dehydrated athletes. When mixed with steroids, it amplifies toxicity. Other side effects. Tinnitus, or ringing in the ears at high doses. Allergic reactions, especially in asthmatics. Dangerous when mixed with anticoagulants like warfarin and heparin. Best practices for bodybuilders. Use occasionally, not daily, unless prescribed for heart protection. If on steroids, then low dose, 75 to 100 milligrams a day, may be justified, but under medical supervision. Avoid high doses, 325 to 1,000 milligrams multiple times per day. Always with food to reduce stomach irritation. Never stack with other NSAIDs or alcohol. Blood tests. Check liver, kidneys, and clotting markers regularly. Final words. Aspirin may be old, but it's not outdated. For bodybuilders, it sits in a strange place. Part painkiller, part blood thinner, part myth. Some swear by it for heart protection or recovery, others avoid it completely due to bleeding risks. The truth is, aspirin is a powerful tool, but like all tools, it can destroy your health if misused. Respect it, use it wisely, and never let a cheap pill cost you years of gains or life.